or mediums like that.
Would you talk about what you mentioned earlier about the medication and how long it's been around and
Sure thing, sure thing. I'm Dr. Joe Ladapo. I'm a physician at UCLA, and I'm a clinical researcher also. And I'm speaking for myself and not on behalf of UCLA. So I want to say that, so I'm thinking of the people who are behind the screens that are watching what you guys are broadcasting. And I want to share with you, because there's so much controversy and the atmosphere is so full of conflict right now, that what this group of doctors is trying to do fundamentally is really to bring more light to this conversation about how we manage COVID-19 and the huge challenge. And that's what this is ultimately about. And bringing light to something means thinking more about trade-offs, about, one of my colleagues said, unintended consequences. And I actually think that's not even the right, that's not the right word. The right word is unanticipated consequences. Really thinking about the implications of the decisions we're making in this really extraordinary time that we're in. So, so I'm sure people are listening to some of the discussion about hydroxychloroquine and wondering, what are these doctors talking about? And these are doctors that take care of patients, board certified, med school, great med schools, all of that. How could they possibly be saying this? I watch CNN and NBC, and they don't say anything about this. And that's the point. There are issues that are moral issues that really there should be a singular voice, So for me, issues related to whether people are treated differently based on their sex or race or their sexual orientation, I personally think those are moral issues, and there's only one position on those. But COVID-19 is not a moral issue. COVID-19 is a challenging, complex issue that we benefit from having multiple perspectives on. So it's not good for the American people when everyone is hearing one perspective on the main stations. There's no way that's going to serve us. So, so the perspective most people have been hearing is that hydroxychloroquine doesn't work, right? That's the perspective that most people have been hearing on the mainstream television. And I believe that perspective too, until I started talking to doctors who had looked more closely, some of the physicians behind me here, who had looked more closely at the data and at the studies. So it is a fact that several randomized trials have come out so far. That's our highest level of evidence, and have shown that hydroxychloroquine, their findings have generally been that there's no significant effect on health. There's no significant health benefit. So that's a fact that the randomized controlled trials have come out so far that have come out. In fact, there were 2 or 3 big ones that came out over the last 2 weeks in Annals of Internal Medicine, New England Journal of Medicine, and I think one other journal. It is also a fact that there have been several observational studies. So these are just not randomized controlled trials, but patients who are getting treated with this medication that have found that hydroxychloroquine improves outcomes. So both of those things are true. So there's evidence against it and there's evidence for it. It is also a fact that we are in an extraordinarily challenging time. So given those considerations, how can the right answer be to limit physicians' use of the medication? That can't possibly be the right answer. And when you consider that this medication, before COVID-19, had been used for decades, right? By patients with rheumatoid arthritis, by patients with lupus, by patients with other conditions, by patients who needed, who were traveling to West Africa and needed malaria prophylaxis. We've been using it for a long time, but all of a sudden it's elevated to this area of looking like some poisonous drug. That just doesn't make sense. And then when you add on to that the fact that we've had 2 of the biggest journals in the world, New England Journal of Medicine and Lancet, as my colleagues say, retract studies that found, interestingly, that hydroxychloroquine harmed patients, right? Both of these studies. and they had to retract these studies, which really is unheard of. That should raise everyone's concern about what is going on. So at the very least, we can live in a world where there are differences of opinion about the effectiveness of hydroxychloroquine, but still allow more data to come, still allow physicians who feel like they have expertise with it, use that medication, and still, talk and learn and get better at helping people with COVID-19. So why we're not there is not good, doesn't make sense, and we need to get out of there.